the home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
countries across the globe have been hit by the COVID-19 virus.
Views,
there's a global trend to see an increase in GBV incidences, specifically domestic violence.
Sports,
What's he say? It's a really good ball. It's Shabalala.
And music to inspire you every day. This is Vuga Online, your inspiration radio station.
Hi there, and welcome to Healthcare Hour with Colleen. Another week, another show. Thank you so much for all your input during the week. It's been fascinating hearing from everybody. I always value hearing from you as to which shows you would like, which guests you would like to hear. And yes, of course, otherwise I end up just talking to me and of course to my guest. As you know, Healthcare Hour is all about healthcare professionals. It's about us understanding that healthcare professionals are people. They get tired, they get hungry, they have families, they have some sort of integration in their lives where medicine can't be everything. It's also about understanding that we need to improve the relationship and communication in hospitals and between healthcare professionals and their patients' families, because often patients and patients' families operate in the dark. And then it's also for the public as patients, also for us to understand that we have autonomy over our health. And before we get to patient status, what can we do to make sure that we avoid being patients? But at some point, life catches up with us, and we need to have autonomy in that somebody else doesn't make decisions for us. We know what's involved, what's not involved. And then, of course, in healthcare, there are issues, there are problems, there are challenges. And these are things that I discuss, obviously, from my own opinion as a coach who works with healthcare professionals, but also from the expert opinion from my guests. So when we come back, we're going to meet my guest for the day, but let's go for the break.
How do you know the life of personal coach you're about to work with is who they say they are? How do you know if they can do the job? At the Africa Board for Coaching, Consulting and Coaching Psychology, we can tell you. So, before you share your secrets and spend your money, check with us first. Visit www.abccccp.com or call us on 012-751-7608. The ABCCP, the professional body for coaches.
Welcome back. You are listening to Healthcare Hour with Colleen QVIST. My guest today is Dr. Nicholas Okumu, and I should have checked with him as if that's how we pronounce his name. But welcome. He's shaking his head at me, or he's nodding his head rather. Welcome, Dr. Okumu.
Thank you so much. I'm happy to be here.
Did we get your name right?
Yes, you did.
Ah, good. Okay. So let me just tell you a little few things about Dr. Okumu. Who we're going to refer to as Nicholas, because doctors are people. We are going to talk about, he is an orthopedic surgeon, and he's a dynamic leader in the healthcare sector in Kenya. He has served as head of Department of Orthopaedics at Kenyatta National Hospital and currently leads the Orthopaedic Oncology Unit at the same institution. He's an honorary lecturer in the Department of Surgery at the University of Nairobi. And then we're also going to see that he owns Jasmine Healthcare and all different aspects. He's written a book, and he's got another book in the pipeline. And he is also an advocate for sarcoma. So we're going to hear about that. I know that he's recently attended a conference, so I can't wait to hear what everybody has summarized for us at this conference. And yes, but first we're going to meet Nicholas the man.
Mm-hmm.
Thank you for joining us.
Yeah, thank you so much for inviting me. And I'm happy, like I said, I'm happy to be here and to share what I can.
Awesome. So, Nicholas, tell us about you growing up and becoming a doctor and then specializing in orthopedics. How did that come about?
Okay, so I grew up in Nairobi. I was born here in Nairobi, Kenya. And my journey with medicine started early in life because unfortunately my father was unwell. He was sick for quite a bit of time, over a year and a few months before he passed away. And that sparked some curiosity in me. I felt like I needed to help to prevent that kind of thing from happening to someone else. And that kind of sparked my interest in medicine. But I'll tell you, once you get into the profession, you realize that whether someone lives or dies is not necessarily in your control. And it's something that you have to accept and live with. So I went to my journey in medicine took me away from Nairobi to Dar es Salaam in Tanzania, where I did my undergraduate degree. And then I came back to Kenya and worked for a few years before applying for a master's program in surgery. And at the time that I was accepted for my surgery degree, the orthopedic program was starting at the University of Nairobi. So I always had an interest in that. And I asked to be switched to the orthopedic program, and they gracefully agreed. And so we were the first batch of orthopedic residents at the University of Nairobi, a total of 3 guys. and
Very
it
big
was
batch, Nicholas.
yes, and
Yes.
it was a very interesting time for us. But we came through that, and I've been practicing now as an orthopedic surgeon for the past more than 10 years now.
Okay. And then explain what an orthopedic surgeon does for our listeners who aren't medical.
Okay, you can simplify an orthopedic surgeon and say he's a bone doctor. I deal with issues that affect the musculoskeletal system. So that's your bones, your muscles, your joints, that kind of stuff. And we come in usually when a surgical procedure is required. So, for example, if you have joint pains, you could also see a physician, someone called a rheumatologist. But when your disease is fairly advanced and you need surgery, then they will send you to us. We also deal with things like trauma, fractures, broken bones, ligament injuries. So we deal with a lot of sports people as well. And I think, but the simplest way is to think about an orthopedic surgeon as the doctor who deals with your bones and joints.
Okay, so the bone doctor, Dr. Bones. Okay, and then you also have a special interest in orthopedic oncology.
Yes.
And so for
So,
that,
yeah, so again, that the simplest way to say that is that I deal with cancers that affect the bone and the other musculoskeletal tissues, so your muscles, your ligaments, your joints, that kind of stuff. And this came about in a very interesting way. When I was the head of Department of Orthopedics at my hospital, I initiated a process of breaking up the unit into subspecialties. And so we formed things like, units like pediatric orthopedics, joint replacement, hand surgery. And as we were forming these units, we figured that we needed one to deal with cancer. And none of my colleagues wanted to do the oncology stuff, but it needed to be done. So I took up that responsibility as the first head of unit. And later on, I was joined by a few other colleagues. But it's become something I'm really passionate about because it's not really dealt with well in our part of the world. If people like to call me a numbers guy, so I can give you a bit of statistics. If you are born in the United States, your chance of survival when you get a bone cancer is more than 70%. In my country, it's actually less than 15%. So you can see the difference is so big. And so it's something that we need to address.
and yes, so a huge difference, 70 versus 15%. You can see it's almost like a death sentence in a way,
Yeah.
depending on where you live.
So true. And then again, the interesting thing is again in the US, for example, despite the treatment for cancer, you almost always never end up with an amputation. You're going to keep your leg even after the
Yes.
treatment is done. But in our part of the world, we do amputations 95% of the time. So if you survive, you survive without a limb, which is really, really tragic because in our part of the world, being able to be fully mobile and uh, able to function is so important for your livelihood and for survival.
Yes. And so it's almost like they're saving your life by getting rid of the problem as opposed to working through the problem to add
Yes,
to your life.
correct.
Yes. Okay. All right. So I'm hearing, Nicholas, that in your journey, you've been a pioneer. You've gone and opened doors that weren't open. You've been the first lots of times. And also taken on what has become a passion, but because nobody else would step up to.
Mm-hmm.
So
Yeah,
good for
yeah.
you.
I
Yay.
think I never really looked at it from that perspective. But yes, we've done a lot of firsts in our country. First batch of orthopedic residents at the university. We have actually the only orthopedic oncology unit in the whole of East Africa. And through that work, we've been able to do really pioneering reconstructive surgeries. We've improved our limb salvage rate to more than 30%. We're hoping that with the program I'm in, which is a surgery advocacy fellowship, that we can actually raise those survival rates to the 70% we see in the rest of the world. And yes, those are firsts, yes, but they are not really firsts because we were trying to do something different. It's just that we're trying to make a difference in the problems we see in our part of the world.
Okay, so on that positive note, let's go for a break. When we come back, we're going to talk about what Africa can do for themselves because, Africa's got so much potential and amazing people.
Yes.
And I know that you also recently went to a congress, the Pan-African Surgical Congress. So let's hear what collectively Africa has decided. But let's go for the break.
The Africa Center for Work-Based Learning is a professional development center for professionals who aim to improve their professional standing. This means that the learning programs we run are more than just academic programs. They are work-based programs that focus on leveraging your current experience as a professional to build your overall profile. A year down the line, the Africa Center for Work-Based Learning is developing into a preferred center for professional development in Pretoria, with 8 professional development faculties including accounting, teaching, entrepreneurship, as well as IT and many more. For more information, go to acwbl.org or dial +27 12 751 7608. The Africa Center for Work-Based Learning, where work is learning.
Welcome back. You're listening to Healthcare Hour with Colleen QVIST. My guest today is Dr. Nicholas Okumu. He is an orthopedic surgeon with a special interest in orthopedic oncology. For those listening and going, what on earth is that? Those are bone doctors and specifically cancer of the bone. And he's been telling us about how he came into his career. He thought he could, because of his dad being sick, but he realized also that it's actually out of control as to who dies and who doesn't die as a patient. And yes, we can talk about that later as well. But also seeing as well that has been a pioneer, the first in lots of places, has gone and opened doors, and is also actively working now to make sure that Africa improves, for example, their success rate in terms of oncology of a limb, and that amputation is, let's just cut off the limb. And whereas in America, for instance, 70% keep their limb. So let's look at what is Africa doing now Because you must agree with me that Africa's got so much potential.
Mhm.
We've got people who are gold.
I think I will start by stating maybe an obvious problem, but a problem nonetheless. Africa's problem is leadership,
Okay?
and we do not lack talent, we do not lack skills, we do not lack resources. Africa's problem is leadership, and I think if we can address the leadership deficit that we have in our continent, we can actually make Africa, to use a pun that an American president uses often, we can make Africa great. Not again, but now we can
Yes.
actually make Africa great. So our challenge is leadership. Let's talk about what we can do. Sometimes we feel challenged and keep focusing on what we don't have rather than the resources that are actually available to us that we could use better. And just today, I mentioned something on a social media post that people might find funny. You find African ministers driving around, flying in helicopters, going to launch projects that are more or less incomplete. And for example, opening a hospital that doesn't have equipment and staff. So it's more of we're doing this for the optics rather than to actually make a difference to the people we are doing this for. And in a very simple way, we could just channel those resources we are wasting and put them to better use and make a genuine difference. The country I just visited, Rwanda, now has over 90% health insurance cover for its people. And they do this through what is called a community-based health insurance scheme, where everybody puts in a little. The government then comes and adds up to that pot, and they're able to give comprehensive health care to their people. The same country is showing us the way in terms of efficiency in use of public resources, innovation. And it's so there's already an example of a country in the continent with very little resources that is having an outsized impact on healthcare delivery. So why can't we in the rest of the continent, take up that kind of initiative and
Mhm.
see that genuinely we can make a difference for our people? So to answer your question, Africa can do a lot. The problem is leadership.
Yes. And I totally agree with you there. And I think also the accountability part of
Yes.
leadership.
Yeah.
Because often you'll find that the victim mentality reigns supreme in
hmm
Africa. Of like, oh, but look at us. We are so like at the bottom of the pile, at the bottom of the
hmm
barrel. We can't, and we need you to help us.
hmm
As opposed to saying, no, we can actually help each other.
Yes.
Mm.
I agree.
So
I agree 100%. Yeah.
it's about working also to change the conditioning. I'm
Mm,
reminded often of, when you raise the baby elephant and you put a rope around its leg and then it thinks it can't move. And so even
mhm,
as a big adult, it thinks it can't move. I
mhm,
think almost as well the conditioned mindset of a lot of Africa of like, oh, but we need the handout, we need the this, we need the that. And so
yeah.
it is also the perfect opportunity given the withdrawal of funds for healthcare
mhm.
from a specific country, that we look inwards to say, right, come on now, what can we do? What
It's
should
so
we
true.
do? Mm,
I think it's all about rechanneling the resources we have and focusing it more.
yes,
I want to use a very simple example in healthcare. We keep talking about prevention. Prevention is better than cure. But the only way you can actually do preventive medicine well is if you focus in the primary healthcare space, right at the bottom of the pile.
yes,
Um, uh, I want to give a classic example we use in Kenya of road traffic accidents. Uh, a few years ago, we had a minister by the name Mishuki, very good guy in terms of implementation. So he made a rule and said that all public service vehicles have to have seatbelts. And he ensured that it was implemented. And then he also implemented a speed limit on those same public service vehicles. And the accident rates dropped by more than 60%. Very simple thing. And it
Yes.
then allowed us at the public hospital that we work in to be able to do more specialized surgeries because now we were not focusing on trauma and injuries all the time.
Yes.
And
But also there you can hear what Nishiki did is he didn't just come up with a 50-page document. He
no,
implemented it.
he implemented it. And
Yes.
that's actually the problem we have in Africa. We have written policies on cancer care, how to distribute resources. Right now, we are working in Kenya on what we call a national surgical plan. And these documents actually are fantastic. Other
Yes.
countries actually come and pick them up and use them. But in our country, they just sit on a shelf
Yes.
and nobody actually does anything. But when people actually take up that leadership and implement these policies, they make such a big difference.
Mm. Yeah, and what I'm also seeing as well is having worked in the system, it's very much about when the strategy and the plan, the 300-page document doesn't work, then they think,
Yes.
oh, back to the drawing board, need a new one. And I'm saying, no, could we just turn to page 1 and do what it says?
Actually, there's a lesson I've learned as I've been studying about healthcare quality. When you're running a business in healthcare, you really need to focus on quality. And in the healthcare quality space, what they encourage is something called continuous improvement.
Yes.
You do something, you test it out, and then you say, how can I make this better? And
Yes.
you go again and again and
Yeah.
again until you absolutely perfect the process.
Yeah.
And then you can say, okay, this is perfect. Can we move to something else? And it makes such a difference if that's your mindset that I
Yeah.
need to just continuously do better.
Yeah.
So a failure of an experiment doesn't necessarily mean that it was wrong. It might just mean you need to change one or two things, and that will make it perfect.
Yes.
Yeah.
And it's so important with those iterations that you put it out at 80% and then you say, okay, how do we make it better? Right, like
Yeah.
Jim, stick it out
Hmm.
again. As
Yeah.
opposed to, oh, look at this, it's 120% perfect. And then everyone
Yeah.
says, oh, that can't work. And then they go, oh, okay. And that's it. That's the end of it.
Actually, I think that's a big challenge in our part of the world. We talk an issue to death,
Yes,
and then
the best
and then
strategist in the world.
and then we actually after talking about it, we don't do anything.
No, then we exhaust it. Then we go
Yeah.
rest. Yeah.
Yes.
Okay, so categorically that needs to stop. We need to actually take all those plans off the shelf, dust them off, open them up, and say, right, step 1, what are we going to do? Yes. So in this Pan-African Surgical Congress, what would you say is the overall theme that came out of that?
We are saying there's a crisis in terms of surgical access in Africa and around the world. It's not just Africa.
Yes.
And again, to quote some numbers, when we talk about something called safe surgical services, so there's a coin phrase we like to use, which is safe surgical obstetric, anesthesia, and trauma care.
Yeah.
Over 5 billion people in the world lack access to that kind of safe surgery. And in Africa, that translates to over 1 billion people. And then we realize that surgery is, in terms of the health disease burden, is around 30%. So 30% of the problems that people face health-wise could be addressed by an operation, some sort of surgery. So we're not allocating enough resource. We're only allocating about 2% of our healthcare expenditure to surgical services. So there's a problem. And the solution is fairly clear that we need to invest a little bit more in surgery. And what what the economists are telling us is that a $1 investment in any surgical service gives you a tenfold return. So it's actually more cost effective than investing even in something like malaria or diarrheal diseases, which are important, but we just need to take a little bit more resource and put it in surgery. It will have an outsized impact. We have a problem in surgery in terms of infrastructure, in terms of human resource, in terms of policies, and we need to change that just to make things better. So at the end of the day, the conference conclusions were simple, that leadership is important, that we need to figure out our own solutions here on the continent. And then each country needs to have a plan outlined to solve these problems. So we are advocating for a document called a National Surgical Obstetric and Anesthesia Plan, which is what gives you the roadmap to say, these are the things that we need to do to make surgery better. These are the types of surgeries that are important at the primary healthcare level, at the tertiary level. How much resources do we put into all those things so that we can actually make a difference in our people's healthcare?
Yes. And then
And
I have
doing
to come along to monitor to make sure that people are actually on the roadmap,
100%. And
that it's
doing
not
this
just on the shelf. Yes.
100%. And doing this kind of thing will actually help us to save 16 million lives. 16 million people die in the world every year because of something that could have been solved with surgery. So we are saying that we can make it better. And in terms of the number of surgical procedures that we have a deficit for, the numbers are really big. It's 143 million surgeries worldwide that are not done every year that need to be done. So there's a big gap that we need to address. But if we lay out our roadmap in a surgical plan and implement it, we can actually make a difference.
Okay, so on that different point and on us making a difference, let's go for another break. When we come back, we're going to continue this journey along this roadmap. But let's go for a break.
How do you know the life or personal coach you're about to work with is who they say they are? How do you know if they can do the job? At the Africa Board for Coaching, Consulting and Coaching Psychology, we can tell you. So, before you share your secrets and spend your money, check with us first. Visit www.abccccp.com or call us on 012-751-7608. The ABCCP, the professional body for coaches.
Welcome back. You're listening to Healthcare Hour with Colleen QVIST. My guest today is Dr. Nicholas Okumu. He is an orthopedic surgeon. As we said, he's a bones doctor. He has a special interest in oncology, which means when bones get cancer or the surrounding tissue gets cancer, he hops in there. He's been talking about how Africa has got an absence of leadership and saying that if we fixed our leadership, if we fixed our accountability, we can also change Africa. We can change it drastically. He's saying that in surgery that 143 million surgeries are not done every year, which is quite sad. And out of that, 16 million people then die as a result of it. I know somebody who we both support tremendously is Prof. Maswime, and she's also saying that in terms of equity and access, if you don't have an obs-gynae to deliver your baby, that's where moms and children die in childbirth.
Mm-hmm.
Yes. So, yes. So you've said, okay, so what I'm liking is seeing that countries in Africa are now talking to each other. How do we collaborate? How do we work together?
I think, first of all, we need to break down barriers like visas and things like that.
Yes.
It's a bit crazy to travel in Africa. You probably, yes, you probably need a visa to go to more than 70% of the countries in Africa that you visit. So that's something we need to address. We also need to address trade restrictions. I think there are more barriers to trading in Africa than, Africa trading with Europe, for example. And so that needs to be fixed. Then once we have addressed the barriers to movement and ideas and business, then the collaboration can work. I know I know I'm breaking out a bit, but in terms of what kind of collaborations we can do, it's basically sharing ideas around different research areas, especially, for example, something that's in the news of late is artificial intelligence, AI. How can we leverage, for example, AI to make Africa leap forward in terms of healthcare advancement? That's something I'm actually researching actively, and I would be happy to collaborate with people from all over Africa and do that kind of thing. To give an example of that type of collaboration, there's an organization I work with called Afritech, and it's all about African research. So it's an African Research and Technology Consortium. And through that, I'm already working with colleagues from Rwanda and a few other African countries to do research on prosthetics. But we hope to do even more than that. And we're leveraging actually things like AI to make these advancements faster and cheaper.
Yeah. And I'm also seeing that you're looking for AI tools that solve diverse problems such as the production of prosthetics, diagnostics, healthcare delivery, and even development of precision medicine tools.
Yes. So we with AI, you can actually address the whole continuum of healthcare. So,
Yes.
for example, when we talk about prosthetics, like I told you, a lot of our people in our part of the world have amputations. Can we help them get mobility back? I'll give you a typical journey to make a prosthetic in the traditional way. It would take at least 6 weeks to come in, have your consult. The prosthetist will make a mold, go back and design the prosthetic. You come back, they fit you and test you. Before it's complete, that takes about 6 weeks. But with our technology that we're using with AI, machine learning, and 3D printing, we can actually get a scan of your limb, just a video from your phone. You don't need to come in person. We can produce the prosthetic, which is a perfect fit, and send it to you wherever you are in the world.
Yes.
So, and we can do that in literally 2 days. So you can see how much faster and better that is. And then the weird thing is that it's also cheaper. So
Okay.
it
Yeah.
actually saves you a lot of costs, both direct and indirect, in terms of the money you'd spend to travel and go to a hospital and do all
Yeah.
those things. So those are
Yeah,
the kind
and
of
also,
solutions we try to offer. Yeah.
talking about visas and borders and access across, stories. It's also about, let's have a Congress online.
Yeah.
Let's bring different African countries together and have an online
Mhm.
meeting. Because,
Mhm.
just as much as you and I are sitting in different countries talking to each other, we can have a whole Congress like that.
I agree. Yes. Technology is good.
Yes.
Um, and the funny thing is, it's always much more pleasurable to see someone
Oh, yes, totally.
in person.
Well,
So I guess yes, we can maybe work it out and say let's do some
yes.
hybrid kind of thing.
Yeah.
But I'm old school. Maybe these younger guys, we really
Come
love to
now,
meet people.
Nicholas. You're the AI specialist. Come on.
There's just
But
something about meeting someone and shaking their hand.
yes,
I don't know.
yes. No, I do agree with you that, meeting people, and also what happens is ideas come from ideas. And like,
Yes.
hey, let's go for coffee, or let's have a beer, or,
Mm,
it does spark, different ideas. And then also I introduce you to somebody else who you didn't know, and, it
yes.
is a lot more informal. But I think
Hmm.
we need to see that visas can't be a barrier.
A
We need
hundred
to say,
percent.
well,
Yeah.
given that, how else are we going to do it? And we need to actually go under, over, or through.
Yes.
Yes, we will
I
get there.
agree with
We
you.
will do
I
it.
agree with you there.
Yeah,
I cannot say it better. Yeah.
yes. You may have gathered that I'm very African. There's Africa in my veins, and I come on now, let's do this. Yes.
Mhm.
But then I'm
100%.
an implementer of note.
Hmm.
Okay. All right. And so also tell us about, you're an author. So
Yes.
yes, you're published author of the work, Shadows Behind the Screen, and
Hmm.
you're also bringing out a new book now.
Yes.
Okay, I'm interested in this new book, Selective Excellence, where you're actually saying this whole work-life balance nonsense is a myth.
Okay, so I'll tell you
It is a myth.
the book is coming out soon, and it actually came from my own struggles with the work-life balance,
Yes.
because people used to tell me, you know, you need to to have to do all these things well. You need to be a good doctor, you need to be a good researcher, you need to be a good parent, you know, husband and whatever. And you realize at the end of the day that finding that balance is almost impossible. And also life has seasons. You're not always in the same place in life.
Yeah.
You know, like when you were young, your priorities were different. Now that you're older, your focus is different. I never used to research AI when I was 18, yeah. So
We didn't have
uh
AI when you were 18.
yeah. So selective excellence is about choosing purposefully to do one or two things and do them well,
Yes.
rather than trying to do everything and not doing everything in the
Yeah.
optimal way. So it's saying that you just allocate your life to the seasons that you have. So for example, if right now my focus is research, can I take up that research project, give it my full attention and energy, and produce something brilliant, rather than saying, oh, let me give a little time to research, let me give a little time to this, and ending up not doing much of anything well.
Yeah.
So it's a theory that I've come up with. I'm hoping it will catch, but we'll see.
Yeah. So
Mm,
you're also saying instead of juggling 20 balls,
yes.
you're saying choose 2 balls carefully and juggle them
Mhm.
beautifully.
100%.
Yes.
I think that's the best. That's a good description of what I'm
Yes.
saying. Yeah.
And for me, I've also said as well, we need to add integration. How do you take your
Mm,
children to work? How do you take your work home?
mm,
How do you make it all together? Because people have this idea that balance is like 8 equal slices of pizza.
yeah.
And as you say, at certain times of our life, the career takes up half the pizza. And,
Hmm.
and it doesn't look anything remotely like the story tale of, oh,
Yeah.
look at this. One equal little slice for little Johnny and one little equal slice. No, no, no. It doesn't work like that at all. But it's
Mm,
also about how do you include your children in your work? How do you include your children in your research, your studying, gee, guess what mommy's doing? Guess what daddy's
mm,
doing? Oh, what else could you add to this? Because no matter how young children are, they can add.
mm. Yes. And I think let's talk about how our societies used to be in the past, especially here in Africa. We were fairly integrated in everything. So there wasn't this clear boundary between work and leisure and family and those kind of things. And those boundaries have actually come up as we become more Western. So and that's actually what is producing this pressure of having balance, you know, doing
Yes.
everything fantastically well. And if you look at societies like in the Arab world or maybe Latin America, where they're still fairly well integrated, these pressures are not so much. So the challenges come in when we try to live a very Western defined kind of life, and then we end up facing a challenge because we're creating boundaries that really shouldn't be there if we were to be honest, and
Yeah.
then we're trying to fit in boxes that we don't match.
Yes. Artificial boundaries. And then we deal with stress and burnout.
Yes. So in the
Yeah.
book, you'll find a section where I've actually talked about some of our great leaders, like Nelson Mandela, and what they had to sacrifice in one aspect
Yes.
in order to achieve the kind of success they did in
Yeah.
the other. So it's all about being selective, making an active choice to focus on one or two things.
Okay. So with that, we seem to have run out of time very easily.
Mhm.
You're a delight to talk to, Nicholas.
I was happy to talk to you as well. And I said, just always happy to share and discuss ideas. And it was a pleasure being here.
Yes. So we would like to welcome you back. Please do come back and be part of Healthcare Hour with me, and
Mhm.
also part of VUCA Online Radio, which is an inspiration radio station. We like to do things differently in that we like to inspire to action,
Mhm.
and not do gloom and doom and, oh, look at us, because we have got amazing, amazing people, amazing ideas. Yes.
I will be happy to come back anytime. Thank you so much for the invite.
Thank you.
Okay.
All right. So with that, we've reached the end of the show. Thank you very much for listening. You have been listening to Healthcare Hour with Colleen QVIST. My guest, Dr. Nicholas Okumu, has brought his special sense of humor, his amazing sense of implementation to us, and has explained what has been going on globally in surgery, specifically in orthopedics. And he has promised to come back to us, which is good. So
Okay.
wherever you are, please remember that you are loved, you matter, and you're not alone. And we'll see you all next week.
The home of inspiration every day.
Most people give up on themselves easily. You know the human spirit is powerful.
From news,
Countries across the globe have been hit by the COVID-19 virus.
views,
There's a global trend to see an increase in GBV incidences, specifically domestic violence.
sports,
What's he say? It's a really good ball. It's Shabalala.
and music to inspire you every day. This is VUCA Online, your inspiration radio station.